This is Wellness by Designs, and I'm your host, Andrew Whitfield Cook. Joining us today is Maria Allerton, a clinical nutritionist and functional medicine practitioner who loves puzzles and teasing apart the underlying conditions affecting patients' health. Welcome to Wellness by Designs. Maria, how are you going?
Great. Thanks, Andrew. Good to talk to you again.
Great to talk to you again. It's been some time. Now, Maria, you have this real knack of sort of diving into the web and pulling things apart. Let's talk a little bit first about what sort of quantitative assessments do you use to look at stress? And I'm going to say that word pointedly, stress in your patients.
Well, there's definitely a number of tools that we can use. I mean, obviously, like all clinicians, the first port of call is a really detailed intake questionnaire. So that's the qualitative part. And, understanding where they're at and where they've been also in the last 5 to 10 years, because I find people are maybe not experiencing stress right now when they're seeing me, but they've got a long history of stressful and traumatic events. So that's a really good starting point. And then quantitatively, I usually start with a hair mineral analysis to understand where their minerals are. And that gives us a lot of information regarding their stress response and where they are in their stress response. And then, there's lots of further tests we can look at, like gut testing, organic acids testing, cortisol, saliva testing that usually I do with the Dutch complete test, or clients might bring in already existing cortisol panels. So, a whole bunch of tools depending on, I guess, where I feel their key issues are and how it's affecting them.
Right. Now, you said something very interesting there, and that was how they're presenting with, they may not be presenting with stress now. So you use these quantitative markers to assess what's really happening. Qualitative, forgive me. So that's a really good point, because how often do we see patients and they say, you ask them how they are and they go, yeah, good, fine, right at this second. So it's kind of like the car that's got a faulty ignition, but not now, not when you take it to the mechanic. So what sort of tests do you tend to rely on to say, hang on, there's something going on in the background?
Yeah, well, I think it's what you were describing there, Andrew, is possibly, and we'll probably get into different stages of stress later, but they might already be in the exhaustion stage, where they've done all the stressing before and now they're kind of just depleted and adrenally fatigued or flat, or what we now call as hypothalamic dysfunction, pituitary dysfunction. So the testing, I think, is really helpful to understand where their adrenals are. So I think the two main ones would be hair tissue mineral analysis and an adrenal cortisol panel, because that's giving you a really good perspective on how depleted the adrenals can be. And a lot of clients can be really surprised when you show them the data and just go like, oh, well, I thought I was fine. I'm functioning pretty good. What do you mean? My adrenals are depleted. So it's always quite an interesting exercise. And I think that's where quantitative data is really great, because it's evidence for them to kind of go, oh, hang on, actually, I think, all of this has taken a toll and I might need to make some changes.
Can you take us through, because I constantly get confused between qualitative and quantitative. Can you take us through that differentiation, please?
Yeah, sure. Well, this is kind of going back to my marketing and economics career days. So qualitative is the data that is coming from the subjective person, so that's about I feel this, I don't feel that, and it's usually the questionnaire identifiable. So, it's data that the person themselves describes as is relevant to them. And quantitative is, data that is done by analysis, testing machines, number crunching. So all of those more empirical, I guess, data collection ways. And I think, we can assess both of them are really important, because qualitative information changes with time as well, right? So, if they've done a mood questionnaire like 6 months ago, and then we've done a whole bunch of treatments, they can redo the questionnaire and assess it themselves, which is helpful. But usually humans are just not very good at remembering how they felt several months ago. And I think there's a lot of subjectivity that comes into the qualitative stuff that needs to be balanced with quantitative.
And also, when we say the word stress, I said that I said it pointedly. So let's go into that word stress, because it's more than, as you say, that qualitative aspect. It's quantitative as well.
Yeah, for sure. Well, I mean, we know that the body goes through many different changes when it's under stress. So every single system in the body will undergo a change, from our breathing rate to our digestion to our muscle contractions, everything that happens in the brain. So it's a multi-system response. So stress is something that we experience, I guess, as a reaction to the environment. But what I find is really interesting is there are different causes of stress that can be quite physiological. So when you say to someone, your data, your quantitative testing is showing that you're stressed, and they say, oh, no, I'm fine, like I'm really fine. I think a lot of it is about understanding what's driving their stress. So it might just be the obvious, children, family, work, driving car in traffic, all the usual stuff. But it can also be very physiological. So a lot of the time I look at things like blood sugar dysregulation or digestive function. So, for example, if someone is having continuously low blood glucose levels, like they're eating 2 meals a day or 1 meal a day, or they're just, doing strange fasting schedules and things like that, that low blood sugar is going to release adrenaline in the body to get picked back up. So a lot of people's stress comes from just mismanaged blood glucose a lot of the time. And also, things like caffeine. Quite often you see all those cortisol panels and everyone looks okay except for that mid-morning. And I'll always ask, oh, what time did you have your coffee? And it will be, 9 a.m. I had my coffee. So, and they get this massive cortisol spike. So as Andrew lifts his cup. So yeah, there's a lot of
Takes
physical
a sip.
factors. Yeah, physical factors that we experience on a daily basis that are not necessarily traditionally what we call stress. But they really take their toll. Yeah. And even nutrient deficiencies, everyone is nutrient deficient these days. So a lot of people are really depleted in magnesium and zinc and, all the really important nutrients that modulate the stress response. So they're going to be much more susceptible to not dealing very well with stress when it does arise in their life.
Yeah. And stressors can present in so many ways. I see you right now taking a sip of water, which is, of course, what I should be doing. But anyway, but even just that, we talk about stimulants and blood sugars and reactions to food. But not too long ago, I saw a guy, thankfully, he took a seat, because what I saw from my perspective was I was looking in his direction, and his wife was bent over talking to his ear, if you like. So the back of his wife was facing me, his face was towards me, and I saw him roll his eyes, and I thought, oh, hello, they're having a Barney. He's fed up with something. And then he slumped. He totally went out, and I thought, oh my goodness, he's having a heart attack. So we lay him down on the floor, and there was this real there were some symptoms of a heart attack, but then there were some symptoms that just weren't gelling. And I was going, this doesn't sound like a heart attack. There's no pain. There's no, massive unconsciousness, blah, 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 blah. So he was still conscious. He came out of it, if you like, to some degree. And I'm going, that doesn't seem like a heart attack. It seems like more low blood sugar, diabetes. What's happening here? And we had to call the ambulance. So I'm thinking, do I give him sugar when he's coming out of it? So there was this whole conundrum, do I give him something by mouth, whereas the ambos are not going to like that. So we sort of gave him some ice. And the short of this story is he got taken away by the ambulance. And I thought that wasn't an AMI. That was more like a trans-ischemic attack or something from diabetes or something like that. Saw him a month later, purely, simply, only dehydration. Just dehydration.
Yeah. For sure.
It was amazing.
Yeah.
Anyway, so stressors can be quite simple thing, and they can have quite dramatic results, I guess, is the short story of what I should have said.
Yeah, and look, it's those, I guess, big things that we need to look for, so not necessarily trying to fix a tiny part of the problem, but firstly, that's what I personally do in clinic, is look at the big things. So hydration, food frequency and intake, breathing, exercise versus sedentary lifestyle. So they're the really big things that will affect the body in massive ways. So I find dehydration, how many people are dehydrated? 90% of the population is chronically dehydrated. So that's a massive, massive factor. And it might not be always as dramatic as the example that you've just given, Andrew, but it could be chronically, at a lower level. So if someone's drinking 1 liter chronically, instead of needing 2 or 2.5 for their size, that's going to take a toll on the system. And also that's the electrolytes, right? So that's where hair analysis can be really useful, because you're looking at the minerals, and that hydration or lack thereof is going to be very evident on the electrolyte balance, which is stress, sodium, potassium. They're the big ones that we look at. So
take us through some little hints and tips with this, because we get, if you've got toxic mineral overload, the leads, the cadmiums, the mercuries, things like that, then if they're being excreted, it's your body attempting to get rid of them. But what about nutrients when you see those in hair mineral analysis?
Yeah, well, both the heavy metals and the nutrients are always indicative of what's going on in the body. So I guess we're looking not just at things that are, too high or too low on hair analysis. I think one of the big things that's important to look at is ratios. And, they need to be in a certain balance. So minerals like, calcium, magnesium need to be in relation to each other and to all the others. And that's where a lot of the issues actually arise, is this really dysregulated mineral ratios. So, someone might be showing up like they're excreting a lot of, say, zinc, for example, on the hair analysis, but it's, really nobody is very abundant in zinc these days. So if you're seeing that, for example, it's more to do with their body not being able to absorb that particular mineral. So it's a little bit tricky. It's not like there are rules to any of this. It's a lot of it is interpretation and putting that together with the client in front of you. But we do tend to lose a lot of good minerals, and same with magnesium. If you're seeing that, for example, on the hair, really high magnesium. No one really has high magnesium unless they're a practitioner and they supplement really properly every day. So it's, you need to kind of think about what's happening with the person. A lot of people don't absorb minerals really well because they don't have the cofactors. So like magnesium and B6, for example. So there's a whole bunch of things we can look at, but it's really those 4 big minerals that are really important: calcium, magnesium, sodium, potassium, that can tell you a lot about someone's stress levels.
Yeah. And you said high magnesium. Of course, we'd have to look at renal disease and just get that out of our concerns, area of concerns. You also said something very interesting before. These terms roll off our tongue and we say them, but what do we mean? For instance, Dr. Brad Leach has corrected us from saying leaky gut syndrome. There is no syndrome. It's leaky gut, whether you've got hyper-intestinal permeability or whether you've just got normal intestinal permeability. There's no syndrome to it. And along that sort of lines, with regards to stress, when we say our adrenals are depleted, but you mentioned before, it's really our hypothalamus that's depleted. What's going on here? Where do we look? What should our language be?
Well, I think it's really, it's hypothalamic-pituitary axis dysfunction. That's the much more correct way of saying it. So, and that's why I think mainstream medicine can be quite dismissive of the terms that are often used, like adrenal fatigue, because adrenals can't be tired. So it's really about, how much stress is the brain being exposed to and our nervous system through the brain, and how that keeps translating into the body. So there's a really awesome chart that's in the Dutch hormone test that I always show to my clients when I get their results back. So it's basically about, okay, what's the brain taking in from its environment, and how is it the hypothalamus interpreting that and then sending the signals to the adrenals? And then it's that constant flogging of the adrenals, make more adrenaline, make more cortisol, make more DHEA. And it's that constant flogging by the brain for us to try and cope with whatever the brain is perceiving as a really stressful environment, and that takes its toll. And I think it's more about just that constant overactivation of the entire system, the entire nervous system. That's where the issues are. So I guess we're looking at the end stage part of it. We're looking at the hormones, like measuring cortisol and measuring all of those things. But it's really about, okay, how much toll has been taken on the nervous system over many, many years. So it's really the brain that we need to look after out of all this.
Yeah. And now talking about stress and stressors, we've got phases of stress. You mentioned a couple of before. Can we take our listeners, our viewers, through these, they're not partitions, but these phases of stress? They were first elucidated by Hans Selye, but there's work on that, correct?
Yeah, I think, that was the original model many, many years ago. And a lot of research recently has been done to kind of, expand on that, and also research within the psychology field, which is, really fascinating. So traditionally, Hans Selye talked about the alarm stage, the resistance stage, and then the exhaustion stage of stress. And, that humans kind of go through all those three stages in a chronic stress response, right? So someone might just be experiencing the alarm stage of, someone cut you off in traffic, you get that, reaction, like you react, your heart rate goes up, you get a bit sweaty, you probably shout some obscenities at the person, and, you feel a bit stressy, and then hopefully by the time you got to work, you might be feeling pretty calm and, back to your normal day. So what happens is, if the stresses are continuous and chronic, and they're much more severe than traffic. So, for example, someone's going through a long separation or trauma or something like that, you're going to go through that resistance stage after the alarm. So that's when the body's trying to mount all of its resources and trying to deal with what's going on. And then if the stress is too overwhelming, you kind of get to the exhaustion stage, which is like what we call adrenal depletion, where, you've been fighting for so long, the body's just had enough and it's just gone, okay, well, we're done now. We're just going to rest and hibernate. So that's when, the thyroid might kick in and put a stop to everything, and you get a very slow metabolic rate, and you basically want to kind of sleep a lot of the day. So I think that's sort of been the framework for quite some time. But, there's more recent research around what they call the window of tolerance, which is about, how wide is our window of tolerance, and lots of therapies that are aimed at expanding that window and allowing the body and the brain to, I guess, deal more effectively with stress and process the emotions that go with it much better. So I think that, there's a lot of different research that's been, built upon Celia's original framework. And I guess for clinicians, you can see on hair mineral analysis, for example, and adrenal saliva panels, you can see and tell usually what stage the person is at based on where their adrenal hormones are.
Gotcha. I remember one of the quizzical things that people with chronic fatigue used to commonly talk about, and that was that, particularly up here in Queensland, where it's a warmer climate, certainly in summer, but they would get home, they're totally exhausted. They're the typical people that will not learn the word or the meaning of pace. So as soon as they get some energy, they go hell for leather and they fall flat on their face. And when they do fall flat on their face, a lot of them used to talk about going home and lying on the floor, like lying on a cool floor, like a tiled surface. It was really interesting. I never got around to figuring out why. Was it like, is it purely fatigue, or is it heat? Is it like dissipating heat or something like that?
Yeah, that's interesting. I would say lying on the floor with your legs up on the wall, that would be like an even better recovery position.
Okay, so
so that's like a
BP.
really good yoga recovery position, and just allowing, the blood to flow back to the heart. I think it's probably to do with their blood pressure, because blood pressure is going to be quite low when you're adrenally fatigued. So, standing up is going to be a challenge, and that standing up and down, that orthostatic hypotension tends to be quite a common symptom, where someone stands up quickly and they feel really dizzy. So I think it's probably more to do with just lying down. I'm not sure about the temperature so much. I think it's just everyone feels better. And, yoga, when you do the yoga class and at the end you've got the recovery shavasana, and it just feels so refreshing, like it's just so rejuvenating. People stay asleep past the yoga class. So there's definitely a really good way to recover your adrenals, particularly in the afternoon, where lots of people have that afternoon slump, around 2 or 3 p.m. Just lying down for 10, 15 minutes on the floor with your legs up on the wall is amazing. Like, I used to do that all the time. Really helpful.
Okay. And when we're talking about these assessments, I want to just snip this off before we move on to treatment and how we look after people. But when you're looking at something like hair mineral analysis, which is, I guess, more of a chronic assessment, then you're looking at something like a cortisol awakening response or daily cortisol response. And that's looking at a day. I don't know how you compare that every day, but anyway. And then looking at something like a rather acute assessment, like these new continuous blood glucose monitoring patches that you can wear. Where do you utilize each of those?
I love all of those. I've used the continuous glucose monitoring with quite a few clients. They're usually the ones presenting with really obvious glucose fluctuation issues. They're fantastic. And, you get a chart that shows you 24 hours a day, where someone's glucose is at and when they ate, and, middle of the night and things like that. So it's usually with severe stress, what I find is people tend to get very hypoglycemic, and especially at night, they can hit, 2.93 glucose on their monitor, which is very low. And that's when they report, that waking up at 3 a.m. startled, sweating, and beating heart, and not being able to go back to sleep for the rest of the night. So stress can be
like a Samonti effect.
Yeah. And it's, classic when people are going through adrenal stuff, I should say stress stuff, that's where a lot of people are really, really responding that way. And, it is a really good way to look at what's happening with their body and when they're eating and drinking and things like that.
Right.
Yeah, hair analysis is useful for longer term, but I do use it for everyone, for assessing where people are right now, because it can
Mm.
definitely change quite quickly as well. Within 4 or 5 weeks, you can affect a lot of
Okay.
change. But glucose monitoring, absolutely brilliant, because a lot of people these days are not even realizing, they're having a panic attack when they're hypoglycemic, and it's got nothing to do with their world or what's happening to them. It's really to do with really, really low blood glucose that's not getting corrected.
Gotcha. Okay, so let's go on to how we do care for these patients. What sort of nutrients and herbs and lifestyle changes and dietary changes do we employ to help our patients? So can you maybe go through one or two, or maybe three different type of recent case histories where you've got differences in how you looked at these patients and how to care for them?
Yeah, sure. So I might continue with the hypoglycemic example. So I was thinking about a
Mm?
particular patient when I was talking about that, who was a young mum, very stressed with, both her kids were having various issues, developmental issues, food allergies. The younger one was still breastfeeding at night. And, just the amount of stress that she was under was incredible. Disrupted sleeping, due to co-sleeping and breastfeeding. And she was extremely slim, very almost underweight. And she started having these really high insulin and blood glucose readings on her blood tests. That's another one we forgot. Yeah, obviously blood tests are a great way to assess some of these factors as well. She started having elevated insulin readings. So we got the continuous glucose monitor. And as I would expect, she was really crashing, particularly at night and in the early afternoon. And having blood glucose readings of like 2.9. And she would get severe panic attacks. She'd lose her vision, start shaking, which was really dangerous, of course, when she was looking after small children.
Mm.
It was very, very scary experience for her. And the treatment really focused on, she didn't have a huge budget. So we only did bloods and hair mineral analysis. And she was extremely depleted in all the minerals related to insulin and glucose regulation, which is magnesium, zinc, chromium, vanadium. And, once we started correcting that, particularly with magnesium, she was doing really, really well. Chromium actually made a massive difference for her. And even her blood insulin readings improved after about 1 month. And she stopped having the really acute responses quite quickly. So no more blanking out, just staying really even. We did a lot of lifestyle and dietary work as well, of course. And, the critical thing for her was to really eat frequently, especially as she was still breastfeeding and really underweight. So it was about,
Right.
lots of protein snacks, lots of protein smoothies, really good hearty meals with, some complex carbs and veggies. She's doing much, much better. So I think
That's
that's
really
a really...
interesting. Sorry to cut you off. It smacks of, I said it before, but not clearly, it smacks of a phenomenon that occurs in some, they call them more brittle diabetics, where they wake up with a high in the morning, a high blood sugar reading in the morning. And so the endocrinologist, GP, normally puts them on higher insulin. But when they look back, it was called the Somogy effect. I'll put it up in the show notes. And it was an effect whereby, as you said, in the night they have a low, the body's rescue mechanisms kick in, like adrenaline, which comes into play really quickly and releases blood sugar to save them from the low. And so they end up in the morning with a high. And of course, that's what they see. That's what they treat. The treatment correctly is not to give them more insulin, but actually to give them less insulin so they have that more even blood sugar control. But obviously look at why they're having that issue in the nighttime. Very
Exactly.
interesting and confounding sort of thing. Quite controversial in its day. I don't know if it's accepted today. I'm not sure. But that smacks of that sort of scenario, doesn't it?
Yeah, and I find, even with people diagnosed with diabetes, it is really a lot of the time an adrenal problem. It's a gut problem and an adrenal problem, where there's just a really poor utilization of fatty acids, for example. So they usually have a mitochondrial issue actually getting the nutrients in, and that's driven by heavy metals and stress a lot of the time. But yeah, it's that sleeping through the night. And what I often recommend, which is a really simple trick and really easy for everyone to do, is to eat something right before bed for people who are experiencing that. So maybe like at 9 or 9:30 p.m., have a protein snack. So like, an egg with a small piece of fruit or something like that. So you need protein and a bit of natural healthy glucose. And I find for a lot of people that helps them sleep through the night without having that 3 a.m. stressy, low blood sugar wake up. That can be
Gotcha.
quite helpful until the body regulates everything itself again.
Yep. And so what about some other case histories, maybe where, cortisol awakening response or the Dutch test shone?
Yeah, well, quite a lot of people that I see, I can't even think of a single one because there's so many, but there's so many people that I see with the really low cortisol showing up on those tests. So the exhausted, the depleted, the exhausted. And a lot of the time, they're people who've had problems with stress for most of their lives. So they've either had a very stressful childhood or, were in an abusive relationship, financial problems, financial stuff tends to be extremely stressful for a lot of people. And, they're kind of stuck in this exhausted, getting through on caffeine and sugar, chocolate, alcohol, whatever it is, to prop themselves up and get through their day. And then they're just crashing. And these people usually sleep really well. So it's kind of fascinating. They will sleep for 10, 11, 12 hours because they're so, so depleted. And
Yeah.
it's more about actually getting them back up again. So I find, I'm not a herbalist, but for the herbalists, things like adaptogenic herbs can be extremely helpful. Herbs like rhodiola, they really help people get back up on their feet. And from a nutritional perspective, it's definitely more the amino acids that I find are really helpful. So things like tyrosine, 5-HTP, all the amino acids that help us with dopamine and serotonin production to get that
Mhm.
motivation back up, particularly dopamine, but they work together just to kind of go, okay, I can do this, then I don't need to rely on caffeine, slowly weaning them off their stimulants and, yeah, getting that natural dopamine production back up. But at the same time, really gentle recovery steps with exercise like walking and yoga. And my favorite is actually weights, getting them to do some weight training in a very low impact way,
Mhm.
without high cardiovascular involvement, just to get the muscles working and the mood to a better place, because adrenally depleted people are going to be pretty depressed. That's a
Mm.
classic characteristic. So, yeah, those, I'm sure all the clinicians are seeing clients like that every single day because a lot of people are very depleted, especially over since the last 2 years.
Yeah.
And I guess, yeah, maybe I'm just thinking of a third scenario. Um, Probably someone who's still quite active in the stress response, the really wired insomniac type person where, they're probably working in a corporate job or juggling kids and family responsibilities, working, yeah, longer hours or doing things for a long time at night. And with these people, I find sleep hygiene is really, really important as a lifestyle tool. So it's more about, getting them to wind down before bed. And again, magnesium is the hero, but also nutrients like L-theanine and, lifestyle things like wearing orange blockers if they're going to be looking at screens late at night. Breathing. Breathing is a really, really massive one where people create stress in their day because they're not breathing properly. So, yeah, trying to take those really long, deep breaths and make sure that, their nose is not blocked at night, that they can breathe through their nose, maybe even some mouth tape to make sure that that's happening. So it's, people can be, I've kind of lumped them into characteristics, but everyone's very
Yeah.
individual. But
Yeah.
they're probably the most common sort of presentations.
I like that thing about mouth tape. I think my wife's going to suggest that
Mm.
for me for different reasons.
You're
But
snoring and need mouth tape.
no, just to shut me up.
All right.
Mim Beam actually took us through some very important lessons about breathing. And I am absolutely stunned by how many people, my work colleagues, how many people, and particularly women here, do not belly breathe. And when you ask them, you can even get them to put their hand on their abdomen and say, breathe into your hand. And they won't. They'll still go
Yeah.
up with their
Yeah.
hilar aspects of
Yeah.
their lungs. Amazing.
Yeah. Yeah, it's a really common thing. And, it's tricky for clinicians as well. Like, I'm being really conscious right now. And, whilst you were talking, Andrew, I was taking lots of belly breaths, and I have a tendency to speak a lot and speak quickly. And I have to kind of force myself to slow down and do those deep breaths in between. And I find it's for clinicians, it's quite tricky because we spend a lot of our day talking. And when you spend a lot of your day talking, you're kind of tending to mouth breathe a lot because that's what you're doing. So you can get quite dry. So I think it's really important as well to, just to slow yourself down, and in between the conversation, really focus on the depth of the breathing, because it can drive a lot of cortisol. When I didn't know about this, and I would spend 2 or 3 hours in consultations all morning without breathing properly, I'd actually get quite sweaty. Sorry to be gross. Like, I'd have like sweaty underarms, and I'll be like, well, I haven't even done anything. I'm just sitting here. But it's a cortisol response because of the under breathing. So it's really, really important to pay attention to that throughout the day, multiple times.
Got it. And just last couple of questions. We're talking about nutrients mainly, because you're a nutritionist. Magnesium's come up, but we forget about simple things, the old things for the adrenals. And I just want to make a point about, when we say the word adrenal exhaustion, it may not be the physiological or biochemically correct pathology, but that doesn't mean that we don't need to support the adrenals. We certainly do. But with simple nutrients like vitamin C, you mentioned chromium. What about the different forms of chromium? What about the doses of vitamin C that you use? Vitamin B5, B complex. Do you utilize these as well?
Absolutely, all of the above. Yeah. So usually I'll do all of them in an adrenal protocol. Vitamin C, fundamental, really good to get a high quality vitamin C, a Practitioner brand, definitely. And you need quite high dosing. So I think the thing that people don't realize with vitamin C is they kind of just pop one of those 500 milligram tablets and per day and think that they're doing something. So you need quite high doses of vitamin C throughout the day, because it's not something we retain in the body. It gets used up quite quickly, and we don't have a storage facility for it. So I usually will do like 2 or 3 grams 3 times a day for most people with adrenal depletion. Really, really high dosing to bowel tolerance. Obviously, if they're getting loose stools, you need to back off. But they can gradually increase the vitamin C and just watch how they're feeling. But most people, you can see it on the organic acids testing, most people are highly depleted in vitamin C. And, they think if they ate half an orange per day, they're doing great. The amounts that we need are pretty high. B vitamins, every single person I see gets B vitamins, different ones depending on what their needs are. You mentioned B5. There's a lot of research around B5 and stress tolerance and stress management. But again, the dosing you need is quite high, usually like 2 capsules 3 times a day of the standard amounts. B6, also really, really important for particularly magnesium retention and serotonin production. And a B complex, everyone pretty much these days needs a B complex, I find, because with all our various, genetic variations with MTHFR and a whole bunch of other genes, B vitamins are not something that we very easily absorb or get enough of. and many people need much higher physiological doses of each individual B vitamin. So, you can see that again on organic acids. Yeah, so it's a whole bunch of nutrients that are really important. Chromium and vanadium are usually used together because they play really close roles. So it's assessing, that's why I like doing the testing. I guess I'm more of a, clinical, like functional nutrition on that front. I don't sort of do like, my gut feel is you need B5. Like I really like testing and actually, benchmarking where someone's at last year versus this year. And I think people really like that. Yeah.
Yeah, good. So I could talk all day about dosing and where we go, how we support. But where can people find out more, particularly about like things like hair mineral analysis? Do you give courses at all?
Yeah, so I've written a practitioner course on hair mineral analysis training, and I guess it's quite different to just learning from the testing companies themselves because it's very practical. So it's all about jam-packed with case studies, nutrient usage, addressing different patterns, and very, very heavy on the tools for clinicians. So there's lots of charts you can print off and have in front of you in your consult so you can interpret the test very quickly. And I find, when clinicians tell me, they've loved the course and they're using it and their patients are getting a lot of buy-in into the process. So it's very helpful to get them on board with insights that you don't necessarily get from blood testing or any of the standard tests. That's why I find it's really, really useful. And, even their mental health patterns can be really evident on hair analysis. So, if you go to my website, truefoodsnutrition.com.au and click under education, you'll be able to find the course. It's been running for about 2 years now and, been getting consistently really good feedback. I'll probably write an extension to it at some stage. It's on the list. But also there's a long list. There's a practitioner Facebook group on hair mineral analysis, which is called Hair Analysis for Health Practitioners. So if you're a practitioner of any kind, you don't have to do the course to join the group. It's just anyone welcome. And people post case studies. You get lots of input from over 1,000 different practitioners. So
wonderful.
That's a good
We'll
resource.
put all of this up on the show notes for the podcast. Maria, thank you so much. It's wonderful always to speak to you. Our listeners won't understand that we were talking off screen beforehand about your overseas holidays, and I'm so jealous and envious of you. But I'm so glad that what you bring in to your patient care is not just the care of the patient, like you're talking about your neurobehavioral clients and things like that, but you're actually caring for the family unit. And so I'm so impressed with how you look at stress and where we can actually intercede to take away stress, not just in that patient, but all those around them as well. And thanks so much for taking us through hair mineral analysis and other quantitative tests, assessments that you use in looking after people's stress today.
Brilliant. Thanks so much, Andrew. Always great to chat to you.
And thank you, everyone, for joining us today. Of course, you can catch all of the show notes, the other podcasts on your favourite podcast app, and of course on the Designs for Health website. I'm Andrew Whitfield Cook. This is Wellness by Designs.